in here. We're very excited to get started. Maybe we'll give everybody one more minute and we'll start promptly at 1:03. All right. Hi, everybody. Thank you so much for joining us today. As we talk about Qualtrics for clinical and translational research, we're really happy to have you here. I hope everyone got to be outside for lunch today and enjoy the sun, go for a little walk. Now you get some food and we're ready to kind of have this fun Qualtrics presentation. So I want to introduce myself. My name is Alyssa Pichi. I'm a project manager here at the People, Place, and Health Collective Lab. I've been here at the School of Public Health for a year and working on a few projects that use Qualtrics. And I'm just really glad that everyone's here with us.
Fantastic, thank you. And thank you, Alyssa. My name is Brendan Jacker. I'm an investigator in the School of Public Health at the People, Place, and Health Collective. And I've been supporting Alyssa and her team on implementing Qualtrics for clinical and translational research.
And before we dive into our presentation, I want to give you all a chance to introduce yourself. I won't call on anybody in the chat, but I do have a poll and I do have a few questions for everyone here just to gauge where you're joining us from today. If you could just answer the poll, if you're from Brown, if you're from URI, Lifespan, or somewhere else, let us know. That way we can get a picture of where everyone's from today.
And then we might do the second question in the poll if we can.
All right, great. So a lot of people here from Brown University, some Lifespan. I used to work at Lifespan, so hi everybody over there. All right, and so the next question we have is your experience and how much do you know about Qualtrics? So if you could just put that poll up in there. Excellent. Give everybody some time to get their polls in. Great.
And we might show the results from that if we can.
Okay, all right, good. So we've got some beginners here, which is great. We were both beginners when we started, and I hope a lot of people here can learn what we did and what I wish I knew a year ago. So this is great. And then, those people who are intermediate, advanced, please share your stories and let us know what also worked for you at the end. And then we have one more question. This is type in the chat. So you get your fingers ready, and we just want to know what you're hoping to get out of today, what you want to learn. That question will pop up shortly for you. All right, good. As that filters in through the chat, thank you, everybody. And then we'll go ahead and get started. Like I said, we're very excited to show you a little bit about what we've learned in the last year about Qualtrics and how we can use it for your research project. What we're going to do is Brendan's going to give us a brief introduction to Qualtrics, and then we'll talk about the projects that we've used it on and how we've made it work for our research studies. And then we'll talk about how we can manage the study participants throughout the course of your study. And then we'll leave some time at the end for question and answer. So we'll hand it off to Brendan to get us started.
Fantastic. Thank you so much, Alyssa. I just quickly wanted to point out to folks in Rhode Island that almost all institutions have access to Qualtrics through your institution. At the end of the slide, we have instructions on how to access it. So if you're not at Brown University or University of Rhode Island, or if you know people that think they can't have access to it, we can share that information. I quickly wanted to start because we realized that many folks may be coming to this presentation knowing about REDCap and understanding limitations of Qualtrics. And here I've pulled in kind of a comparison from a document I saw in 2021 displaying the differences between the two. And I just really wanted to highlight that there aren't as many differences as people tend to believe. So there are ways to get around some issues. There are also kind of like changes that have happened to Qualtrics and changes that have happened to REDCap throughout the last few years. And I feel like they're getting much closer towards each other. But individuals, people that do research often have their, their own preferences or favorites. So in here, we're not going to say that Qualtrics is better. It's just a different situation than REDCap. And it was what was available to us at the time. So just quickly, we wanted to share with you a few key points, things that we might come back to during the conversation. And so we just wanted you to be aware of where we're kind of like pointing towards. So on the left-hand side is the survey builder, and this is essentially kind of like a click and like what you see, what you get. So you can enter in a different type of question, then you just enter in the different choices. It's similar to REDCap in the formats of the questions are predefined, and you can make them easier for yourself. On the right-hand side is what's called survey flow, and that is like a higher level view of your questions. So you have questions that may form a block or a segment. And so this survey flow lets you change how those questions or those blocks are displayed. It also allows you to add in some other elements that we'll talk about today. On the left-hand side here are what are called workflows, or what used to be called actions. And these are ways for you to respond automatically based on a response. So it may be a response that's entered, or it may be a certain time of the day. It will do an action that is automated for you. So we'll describe that as well. On the right-hand side is what's called distribution. So that's the next tab on the survey builder, and that helps you, or is different ways to distribute your survey. So you may use email, you may use social media or text message. We'll just kind of like share that with you as well when we get to it. And finally, the two pages which are kind of like as the responses are coming in or afterwards, the first on the left-hand side is the data and analysis tab. And so that shows you kind of like row level responses. You can see individuals as they come in, you can see when responses are in progress but not completed. So this is kind of like if you wanted to double check what's coming in through your survey. And on the right-hand side is the aggregate of that. So you can produce results and reports based on your data. If you wanted to say what proportion of our respondents are identifies male or identifies female or other, you can use this as kind of like an aggregate reporting system. So we just wanted to let you know what these parts are. If you hear them coming up, then they're kind of like you're in the back of your mind. I quickly wanted to touch on fraud because I think this is a common concern from folks doing particularly internet-based research. So the concerns around fraud is that people can manufacture or manipulate their data to fit the eligibility criteria. People can submit multiple responses with different names or with their own name. And there's also the potential for bots filling out surveys. So these are very real and kind of like important concerns. What we want to do is making sure that we're kind of combating this in an appropriate way, in a timely way, so that we're not wasting our own resources and time, but also not kind of invalidating individuals who should be part of the study. So we want to make sure that we're like treading the line here. And we'll talk a little bit more about how we can approach fraud responses in this survey. Quickly, I wanted to share with you what you may have seen, maybe related to COVID, but other folks call like a Swiss cheese model. And the idea of just putting in multiple layers to kind of like help you as a researcher, include the optimal participants in your study. So you might think of it as having kind of like a simple process within Qualtrics, maybe like detection software that is in front of a screener. So you can stop people getting to the screening, which is in front of the main questionnaire, which is in front of, cleaning at the end. So we wanted to insert a number of different ways to make sure that your data is accurate and correct.
All right. So actually, a year ago this time, we were given a project and Qualtrics, and we started putting together surveys and building a survey. And so I'm going to talk about that project and a little bit of what we learned. And hopefully you'll see some similarities in this project and maybe something that you'll be working on that it'll be helpful for you. So the study is called Mobile Peer Support. And it's a RCT, it's a randomized control trial. And it was a pandemic project. Actually, during the pandemic, researchers needed a way to recruit individuals 100% virtually, 100% remotely. So the PIs of this study are Megan Rainey and Francesca Bodwin, and they created this study, and it's all done 100% remotely. And it is a longitudinal study. We are recruiting participants for over the next 2.5 to 3 years. And participants are randomized to either a smartphone app. It's a peer recovery support app for people who are in recovery or receiving treatment for an opioid use disorder, or they're randomized to receive the control, which is just standardized resources that are already existing online, again, also virtual. We're looking to recruit 1,300 participants in the US for this study. And then the outcomes are patient-reported surveys as well as administrative data linkages. So we needed something that was able to do that survey component, but then also be able to link the data at the end of the study. And because it was trying to meet a criteria of recruiting everybody virtually, we are only recruiting participants from social media and online, through paid ads, sponsored ads, and things like that. So this is a big picture graph of what it looks like to move through the mobile peer support study. So what happens is participants will self-screen in Qualtrics. They'll come across our Facebook ad, they'll take it, they'll screen it. If they're eligible, it'll get sent to our team and we'll review it. And then our team will determine if they're eligible or not, reach out, make contact, schedule their visit, reach out if needed, reschedule if needed, all of those pieces. But then when they attend their baseline visit or their first visit, they're consented and then they're enrolled in the study. If not, they're a screen fail and they're screened out. But if they are enrolled, then they get sent follow-up visits in 1, 3, and 6 months for this particular study. And Qualtrics has been really helpful and useful to send these automatic reminders and automatic follow-up visits. And then we repeat that for each of the participants. And so, you saw what happens and what the study team sees happen in this particular study, but this is how we see the data in Qualtrics. And so it moves through, the screening survey comes in, the data gets put into a contact list, we embed the data, and this is useful for their first enrollment and baseline survey. And then what happens at the end of that survey, so that we can randomize the participant and figure out which group they're supposed to go in. We have a way to talk to this randomize.net, and it figures out which cohort the participant belongs in. And it uses different demographics to determine which cohort. That information is then sent back to the baseline visit, put back into the contact list, and then at 1, 3, and 6 months, it knows which follow-up surveys to be sent to this participant. The 6-month follow-up survey is different depending on which cohort you're in. So Qualtrics has been really useful to be able to split up those surveys so that, the prospective participants get the correct follow-up survey. So that's just a flow of how we've made it work in survey. And then we've simplified it down. So this is what the participants see. They see getting screened, getting consented, getting enrolled, they're followed, and then they're completed and compensated. And so this very simple process is actually a lot more complex, and as you've seen in the previous 2 slides.
So what we want to do now is kind of walk you through why we went with Qualtrics, some things that are helpful and not helpful, and really kind of outlay or overlay this information across that last slide that Alyssa shared. So to help you understand kind of like as individuals move through the study. So we're going to touch on each of these points. I won't kind of read them out, but we'll jump into why we chose Qualtrics in the first place. And the simple answer is it was available. REDCap is not available at Brown unless it's in Stronghold, which is a secure environment. So we couldn't use Stronghold, as far as we understood, to get folks from the community to do their own surveys. It would have required us to sit in between the individuals. The option to use the Lifespan REDCap was there, but it would be challenging for our staff to be based at Brown, not be located at Lifespan, but to use their resources. So we went ahead with Qualtrics. Qualtrics is also approved for level 3 data security, which is the highest level at Brown University. So we're able to capture PII and PHI with Qualtrics. And our colleagues at the Centre for Digital Health, where Dr. Rainey is the director, have had experience using Qualtrics in the past for their research. So we really leveraged their expertise and the knowledge at Brown for choosing Qualtrics. One of the main reasons, or maybe not main reasons, but one thing that we've noticed is kind of how intuitive and easy to use Qualtrics can be to get started. It's visually, I would say personally, an improvement over REDCap. There are many places where you can customize the look and feel of your result, your study, which can be overbearing, but as stepwise, you can really get started quite easily. You can use data import methods. So if you have your information in a spreadsheet or in a Word document, you can import it as plain text. We also appreciate that you can store your questions or your blocks of questions in a library. And so you can essentially create the survey one time, store it in the library, and then use subsections of your survey, say for follow-up. If you're asking a pre-post question, you don't need to recreate each kind of block of questions. Similar to REDCap, we love the idea that you can validate your tools, that we can clean up messy data before it gets entered. So there are a number of validation tools, for example, validating on email and phone number for US postcodes and addresses. One of the other great things that we've found in Qualtrics is being able to draw on information using the autocomplete method. So we ask folks to enter in their address. Using Google Maps, we can kind of control and make sure that the address that we're receiving is standardized. It's very helpful for us, particularly when we're trying to match folks geographically. And finally, I would say that the contact support function, particularly for folks at Brown who have access to this, has been really helpful. If you contact support at Brown, they'll kind of video record your conversation and send it to you, and they'll walk through with you in live how to address your questions. So we found Qualtrics contact support function, which I believe Brown pays for, to be very helpful, but also the larger community. There's a community forum and community training that have been very helpful. I wanted to point out quickly a few integrations. I'm not going to go through all of them, but Qualtrics has a number of integrations that you can purchase as an add-on. Brown University has purchased some of these, so we have access to Salesforce, we have access to Google Sheets and Tableau connections. But essentially, Qualtrics has done the work of building API interactions, and you can just kind of click and play. We use, in particular, Google Sheets is one of our kind of most used items. If you're feeling adventurous, you can start using API yourself and create custom extensions. So for our study, for the MPS study, we use a custom API for the randomization process. We'll explain that in a moment. And also, I wanted to touch on quickly this idea of fraud detection. So if we think of an individual coming in, we want to identify as early as we can folks that are not legitimate. So many people, financial institutions use a range of methods to identify folks that are kind of malicious or duplicate responses. So through Qualtrics, Brown University has access to both reCAPTCHA, which is a Google option, and another product called Relevant ID from Imperium. And these are what's called frictionless or passive. So the system detects the user's interaction with the website. So it detects if they're in the same region that their computer says they are. It detects IP and click. So it captures all of this information anonymously and then gives you a report saying whether they think the person is legitimate or not. In addition to that, our team is using short open text questions, for example, asking folks to explain their experiences with treatment or care as a way to identify keywords or concepts. And our advice here is to combine different measures maybe on the back end or in the middle if you can, to identify whether folks should be included or not. I just wanted as well to point out that consenting is available here. One of the criticisms I've seen often is that consenting module is available in REDCap, but not available in Qualtrics. So here, I'm just showing you that you can have a section, kind of like a screen signature from individuals that will get stored and recorded. So we'll capture an image of the signature as well as a date stamp. If your study requires anonymity between consent and surveys, you can set up essentially 2 surveys where the person first consents to the study, leaves their signature, and then completely separately, people get directed to a second survey. So there are options in terms of recording consent and anonymity. And finally, I just wanted to touch on randomization here. So, not finally, but randomization here. One of the challenges of Qualtrics is built for the workplace environment, largely for assessing employee satisfaction. So there's fewer options to do randomizations for clinical research. One very simple option is what's called the randomizer, which is used in the survey flow that I mentioned earlier on. So you essentially would decide whether a person gets randomized to one block or one set of questions. Unfortunately, this doesn't allow block randomization or stratification. So there's some limitations if you're trying to do more advanced randomization, but it is an option, simple, easy to do. A more challenging option is using the API connection. So using the web service to reach out to another website, in our case, randomize.net, where we send all of our information securely. Randomize.net does the randomization and then sends the information back to us saying the person is in arm A or arm B. On top of that kind of external facing process, we also have gone the extra step to use what Alyssa was mentioning before called minimization, which works to balance prognostic factors. So rather than kind of flipping a coin, it looks at the individual coming in and then says, how do they compare to the rest of the study population? And tries to find balance across those factors. So that is an example of kind of a more advanced version of randomization. And we can provide information on how to set this API action up for anyone that's interested. And actually, finally, for me at the moment, is this longitudinal data collection. So again, another criticism or another concern about Qualtrics is that you can't connect surveys across time. We've found that you can use the contact list as a great way to connect individuals across their studies. So in this case, an individual would come in, answer the survey, and their contact details get added into the contact list within Qualtrics. And then all surveys that come after that will reach into that contact list to pull out the information, identifier of that person. So we found that as a way. So rather than in Qualtrics where surveys are built connected, this is kind of like free floating surveys that get connected through the contact list. In our study, we're using 2 different types of surveys. So the on-demand survey is essentially the baseline questionnaire, and we're not able to kind of schedule in time. So the interviewer would have to come in and select the survey to start. To do that, we use what's called authenticators. It's kind of like a login or a challenge. So we enter the study ID, that study ID gets searched in contact list. If the contact or the study ID is there, then we can begin the study. So it's essentially kind of like a filtering way in the way. With the automated email, we know that individuals have to complete their survey at 1, 3, and 6 months. So we just set up in the workflow for the system to send the email out at a certain date and time. Using both of these methods, we use what's called embedded data, which is taking information from the contact list and adding it to the individual's responses. So we're essentially pulling information that would get used temporarily by Qualtrics and storing it with the information. So at the end of the study, you can pull out all of your surveys and link them together using one study ID as a key. So that's the alternative that we've found, and we can give some more information about that as well.
All right, so these are some lessons learned. These are the things that we wish we had done differently, and so hopefully we can share them here so that you don't have to make the same mistake that we made. And so what I strongly suggest is creating a test environment in some sort of beta environment before you create any of the live. You want to be testing or retesting. And then you'll have an environment for, training new staff, making adjustments, never do anything in your production or your live environment. So making those test environments. And then, as your team is making adjustments, schedule time blocks so that people are not making or recreating the, different versions. So just some lessons learned there. And what you can do, and probably maybe the next time I make a survey like this, is considering importing the surveys as a like a text file, and you can just upload everything into Qualtrics. So maybe that would be, reducing any typos or, anything that happens when you're manually inputting something into Qualtrics. And it might save you time, and then you can save that document for your next study and the study after that. So it's just creating those templates that put the work in up front, and then you can recreate it. Something that we found that was helpful is using the survey library. Qualtrics, with anything, there's a learning curve. And so the first time you do it is the hardest, and then every time it gets a little bit easier. And so moving forward, the next studies will definitely be using the survey library to copy and save those templates for future use, because, it turns out that a lot of studies use a lot of the same standardized surveys. Yeah, get that. So it's nice to have them in there, and then you can share them. You can share them within your team. You can share them externally, and it's just a really nice resource to have, we've found. Second, or, here, what we did the first time is that we send it to the IRB for approval, and then we made our surveys. But I would highly suggest creating the surveys in Qualtrics, exporting them into a Word document, and then submitting them for IRB approval. Because what happens is when you go to upload everything that's already been IRB approved, you realize, oh, this is not going to work like that, or this has to be differently. So I would highly encourage creating the surveys, make them how you want them to be made, and then export them for IRB approval. So that way you know what it looks like. You can submit all the display logic, everything that's there for that approval. And then it's just easier for tracking. And then one thing that we learned is that anytime you modify an answer, so say you recode the values and you want to add or you want to shift something around, when you do that, the coded value automatically increases. It does not replace values. So you could work on a study and at the end realize that all of your coded values are not in the order that you want them to be in. So I would suggest before going live, go through each question, opening it up, making sure the values are coded exactly how you want them. It's like over in this picture, you would presumably want them 1, 2, 3, 4, 5, and you would not want to have multiple variables as a 2. So do that, go through, double check it, and then lock the question. That way you know that no changes could be made. So just a few lessons learned. I hope that helps everybody here. And what we're going to go into next is we have the surveys, participants take them. Now what? How do you manage all of the incoming data and what you do there? So we're going to get into a little bit about that. And this is what we've done for the mobile peer support study. So we have set up automated workflows. Brendan talked about that a little bit early on. And you can trigger various tasks. On the right-hand side, we have some photos of how you go in, and the task that we use the most is when a survey is completed, we have it sent into a Google Sheet, and it's like our mobile peer support log. If you work on research, you're probably familiar with an enrollment log or a screening log. And the nice thing about this automated workflow is that it is automated. There's no manual typing. And so you don't have to worry about any typographical errors, at least on the staff side. There's a participant error there and those things that we come across. But it's really nice to have all that information filtered into the Google Sheet, and so that your staff can see it in more than one way. You can go into Qualtrics and view it, and we'll actually get into that. But it's nice to be able to have a tracking log that is really just a copy and paste version of what was in the survey. And so the surveys are also stored in Qualtrics. And you can use a tab that's called Data and Analysis tab. And what it actually does is records finalized and in progress surveys. And this is nice because you can see surveys that have been started and not filled out. And so if someone consents to yes to be a part of our research study and they've included our contact information, what we can do is reach out to participants and follow up, ask them if they're still interested in the study. It's a lot more common than what I ever thought for participants to accidentally hit that submit button. And then so in Qualtrics, you can use that feature. You can look at surveys that are partially filled out, surveys that are fully submitted. You can, everything is in there. But something that I utilize pretty often, as well as the staff, is the search function. And you can look up respondents. We use this for follow-up surveys to make sure that the data is in there, make sure that anytime you have to look something up, a duplicate, something like that, it's very easy to do. You just create a filter. And then with filters, kind of exactly like looking at participants, Qualtrics also has a really great reporting feature. And it's really nice because you can save filters and then you can pull them whenever you need them. So something that we have used is a research performance progress report in our PPR or the continuing reviews. If you have a lot of participants in your study, it can be a lot to pull all of that data. And so Qualtrics does make it really nice. You can create your filter and pull exactly what you need very quickly. We also use them for internal monthly progress reports. And I found that it's, really easy to do, and it's nice that it's saved and you have the same report pulled each month. So yeah, I would highly recommend also using the report function in Qualtrics. And then lastly here, as we kind of learn and we walk through Qualtrics, so in human subjects research, collecting IP addresses is not allowed. And so you will have to go into your survey and turn the anonymized responses on. And that's so that you're not collecting the IP address, exact location information of participants in your study. But what you can do, and it's actually really nice, is you can track surveys through embedded data fields by using these URL query strings. And what's so nice about that is you can see exactly which ad campaign or which survey link or which Craigslist ad that your participant took the survey from. And then it helps you make informed decisions about advertising, your spending, and then any changes to recruitment strategies can be made this way. So if you've got one ad on Facebook doing really well, you might want to invest more money there. And then you've got another ad not doing so well, maybe, divest there. But what was really cool to me as someone I don't really consider myself a tech person. And so I can say that this is really easy, and it's really easy to do because you have your survey link. All you do in the same survey link is you add a question mark to the end, and then you type where your source is. We use Facebook, and then you type in your campaign, whatever your ad is. And this comes into Qualtrics as embedded data. So we have an example here of the client that came in through ATT Sprint. For example, this is the Qualtrics example, but it's really easy. So anytime you have like a referral, we will give a different link so that we can see where participants are coming from. And the nice thing about it is that you can also see links if it has nothing in it, no embedded data. We know that somebody just got our link and it doesn't have anything attached to it. So it might be fraud. We don't know. It's just something to keep in mind. So just a few lessons learned. You've got everything ready. You're about to go live. These are things that happened to us and lessons learned about managing participants that I wanted to share. So you go live, you're going to have a lot of incoming eligible responses, hopefully. Chances are a lot of those, if you're recruiting online, will not actually be legit. They may be fraud. They may be participants or people pretending to be eligible. So have a process in place to deal with those incoming eligible responses, and give a forewarning to staff or whoever's going to be working on the project to pay attention. And so with that, you can lean into the Qualtrics fraud systems to triage, what's a priority, what looks like fraud. There are some types of emails that right away look like just made up email addresses, and you can use that to leverage which are the participants that we're going to reach out and spend the time trying to connect with and who's not eligible. Brendan talked a little bit about the relevant ID. That's just the surface. There are a lot of other paid features within Imperium and more advanced options to confirm a person's identity which we want to explore as well too. And they're there, they just cost money. So some systems that we put in place to verify the participants' identities are pre-screening call. A lot of times we found people will make multiple names or multiple identities. So calling and verifying that the information that they gave you in the screening survey has been really helpful. And then lastly, we found a lot of value in putting open-ended screening questions in our survey because it does allow you to get big picture of the participant before you even talk to them. And so it makes it a lot easier possibly to screen out frauds or just screen out people who just aren't right for your study. So those are some really important lessons when I reflected on the study launch date and the things that we've learned in the last couple months. These were the most important things. So thank you for listening to us. I think we're right on time here, and I think we have enough time for questions, and we hope that you have some. But you reach out to Brendan and I. Like I said, there's a big learning curve, but we are happy. I know there's a lot of people here that use Qualtrics or have studies similar to this, so we're happy to help and share the knowledge that we've learned.
Fantastic. Thank you so much, Alyssa. We just wanted to acknowledge the thanks to Advanced ETR for supporting this presentation, to our MPIs, Dr. Rainey and Dr. Baudouin, and to our colleagues at People, Place and Health Collective who are doing the hard work of collecting information for our study, and hope that this can just be an inspiration for folks looking at alternative ways of collecting data, acknowledging that a lot of maybe misunderstandings of REDCap and Qualtrics kind of capacity, that Qualtrics can just be an alternative, it's not necessarily a replacement. So I'm just going to stop sharing screen and we can get into it. And we have a question from Julia.
Thank you so much for that presentation. That was really helpful. Quick question for you both. You mentioned importing a text document, I think, just to make it easier to create your survey. I imagine that you would import that and it just gives you a basic, shell, and then you would go back and do any loop and merge or any skip logic. Is that correct?
Yeah, that's a good question. So there's two versions of the import. So there's the simple and the advanced. And so the simple essentially lets you put in the name of the question and the responses. The advanced lets you define like multiple choice and the format of the question. As Alyssa suggested, kind of like getting the information in there so that it's like the wording is accurate, and then, as you suggested, going back to make changes in terms of branching logic. Yeah, that's right. So I think you have to kind of like do a bit of both, if that makes sense.
Sure. Is there a special format that you would, if you were to do the advanced, is there a special format you have to follow before you import it?
Yeah, absolutely. And I can drop that in the chat, and we can also send it around with the information.
Thank you.
Yeah, not a problem. We did have some other questions in the chat. Let us see if we can go back and find those. I'm just going to answer Melissa's going in reverse, only because my eyes are that quick. So Melissa asked the question, if I'm Brown clinical faculty affiliated with a FQHC, but not part of Care New England or Lifespan, am I able to access Qualtrics? I believe so. So anyone with a Brown University Google account should be able to go to the website of Qualtrics explicitly and you'll log straight in, fingers crossed. So we will provide the links to that. That's also in the slide deck, but we'll provide it as well in the email. And thank you, Cynthia, for another clarifying. So yes, you should be able to get access through the Brown version. Actually, sorry, I take it back. So Cynthia's question is, as a Lifespan research employee with sponsored Brown ID, can you access Qualtrics? So yes, you can access the Brown version. Lifespan has its own version, so that might make it easier for your IRB process, but you will need to communicate with the Lifespan administrator, and I understand there's a cost for using it in Lifespan, but we can get you connected, Cynthia, and to the person at Lifespan. Alyssa, did you want to take the other question?
Yes, I can take Kelly's question. Kelly's question is, so it sounds like you're confident in the quality of relevant ID. I've read some things that indicate it's not great. So relevant ID is like the Swiss cheese model. It is one piece. We use relevant ID with additional pieces. We just, you know, it's great. It's not great. It's one piece. We use that on top of a multitude of things, you know, looking at their open-ended response. Reading those, is it weird? Does it look like a bot? And then we also use like the duplicate. There is a Verity is the next level. And I think that might be more helpful, but again, it costs more money. So that's something that I think as a research team, you have to decide, is that worth the spend? It might be because it looks at email addresses. But for getting started, when you've got a huge list of people coming in, I think the relevant ID was really helpful for us to figure out, like, this is a duplicate, this is not.
Yeah, and I would add to Alyssa's point for the second product called Verity, the current option of Imperium Relevant ID kind of tells you the basic information about how a person's interacting with the website. Verity takes their personal information and checks against a list of kind of commercially available databases. And so that really identifies whether a person exists. So it says, is this individual, you know, present in the US? But it doesn't say whether the person entering that information is the same, which may or may not be an issue for your study. If you wanted to go a step further, there is other technologies which can have kind of like face scanning recognition software. So that demonstrates that the person you're talking to is the person that they say they are. So it's kind of like layers of an onion, depending on how much you would like to put in. I would also say that we use the relevant ID score with the Google reCAPTCHA score, and you know, the idea being that they have different algorithms so that they may give different results, but we use the information as a whole to determine eligibility. I did see a question about learning different ways to prevent kind of like multiple responses. So one of the advantages of relevant ID is it does give you a score and a date when the person last participated in the study. So it will say a score between 0 and 100, and over a certain mark, it will say, well, we think this is a duplicate, and this was the last time they took the survey. So we use that as, you know, not an immediate exclusion, because we realize that some people may come and have a look at the web page, decide it's not for them, and then return later on. So it's kind of informative for us. If you're doing a study where you want to be completely hands-off, you can build in kind of survey flow. So you might say that a person that the system determines as duplicate automatically gets excluded from the rest of the study. So that's the kind of like survey flow options that we spoke about in terms of what questions does an individual see. We're also, of course, more than happy to share all the information that we've learned from this. We're trying to produce more documentation available for folks to share. Yeah, Alyssa, last question.
Yeah, so Madison's question is, did you guys have Qualtrics assign participant IDs? Yes, and so Qualtrics has what's called, we call it the R code, and it's an R code that's assigned to every single survey that's taken. And so we use the R code from their first survey. It's an external data reference, and that's what we use to connect all the surveys. There is a way to upload and assign study ID numbers to everybody. We didn't do that just because the R code was fine. It was good for what we needed it for. We have no in-person participants, so for us, it's mostly just copying, pasting. So a long digit R code wasn't really a problem.
Yeah, and I would say to follow on from Alyssa's point about the R code, which in Qualtrics is called response ID, sorry. So every individual response to a different survey gets its own essentially globally unique identifier across every survey in Qualtrics across the world. So we use that code, which is essentially like cannot be duplicated anywhere else. And that becomes, as Alyssa said, our like internal code. But because we don't need to handwrite it, we don't need anyone to remember it. It's a 16-digit kind of string of letters.
And I forgot why we didn't use the uploaded version of the study IDs. And it's because you can't confirm that the numbers won't be duplicated. So for the integrity of the study, we want to make sure that everybody has a unique identifier. The only way that we could figure out how to do that was by using the code given in Qualtrics.
Yeah, hello. Hi, I'm Madison. I'm the person that asked that question. I just I figured asking the question in like with a microphone would be easier than trying to type a quick follow-up question. But I ran into the same problem with my study where using that Qualtrics assigned, like picking a random number doesn't like it has the chance of having a duplicate. So were you guys able to track that response ID that you guys were talking about, like through different surveys as well? So were you able to like either design a link for each person based on their response ID before?
Yeah, so that's a great question. That's where we use the contact list. So essentially we said to Qualtrics, remember this response ID because it's temporary, but store it as part of a person's answers. So that becomes then their study ID. And then we insert that information into their contact list, and that then becomes kind of like the key to all of their responses later on. So when we did an on-demand survey for our research assistants, they would use that code to kind of start the survey. When we automated the emails, it went from the contact list and used that response code. So it is essentially kind of self-generated, but you need to tell Qualtrics to keep it in its back pocket along the way. But great question. Thanks, Madison. I just wanted to double check to see if there are any other questions from folks. We can take the chat or feel free to unmute yourself. Just going through the information that folks put in at the very start, seeing what they would like to learn as differences. We're seeing some questions about visualization. So I want to point out that if you have access to Tableau and you're like how Tableau demonstrates information, you can connect the data live from Qualtrics. So there are a few extensions that you can use where the data goes straight from Qualtrics across into Tableau. Because both Tableau, I understand, Qualtrics and Google Sheets are all level 3 data, Brown's approved this kind of transfer of information across. Great. A couple of questions from folks asking about just being aware. We hope that this information just kind of like gives you an inkling to get involved. One of the amazing things that we've found, that I've found, is the support that comes from the community. Using REDCap, whenever I try to get information, I find a document from 2015, or I find a different kind of university's information. One of the advantages I found of Qualtrics is that it really is much more moderated in terms of like the information that you're getting to help you with this research. So there's Basecamp training if you want to jump into training. There's other people have often put in a similar question into the community forum, or there's explicit training and documentation from Qualtrics.
And I'm seeing something here. Qualtrics also has a vocalized dashboarding, which Brown doesn't have a license for. It sounds like it works like Tableau. I wonder, we worked with Stephanie Adoba a lot. She's out of town this week, but she can help us with anything. If we go to her and we're like, oh, we're looking for this, she'll investigate it. She'll see if it's something that maybe everybody at Brown is interested in. So maybe.
Option.
Yeah.
I would also just like to point out that the colleagues at Lifespan do have access to the Microsoft Excel connection. So if you're working at Lifespan, you have access to their questionnaire and you would like to have every response forwarded to your contact log, to your study log, you can use the integration through Lifespan. So we will send out the contact details for folks to get involved at Lifespan and the login details for Rhode Island organizations. Ooh, we have a question from Nancy. So I'll ask the question, and then because Alyssa is in charge of managing the project, I'll let Alyssa talk about it. So the question is, do you have a recommendation or any recommendations for using Qualtrics for project management? For example, tracking milestones that aren't linked to the participants or to the participant contacts. Alyssa.
Oh yeah, we work out of our mobile peer support log. So all of the information is brought over from Qualtrics, and we use the data that's collected in there. You can make pivot tables. You can do that in Qualtrics too, but it's sometimes just a lot easier to look at a pivot table, look at a log. Tracking of milestones.
One thing that I would say is that we spent a bit of time looking into CRM or customer relationship management software. So you might know it as Salesforce or Jira, and it's an option. It's not cheap, but we were looking at ways to kind of like track an individual through time. And as Nancy might be alluding to, is kind of like what % of people finished their 1 month follow-up, or how many people have we screened in general, and kind of like hitting the performance measures. So we are using, as Alyssa said, Google Sheets to manage this, acknowledging that it's kind of like a simple way. It's not a relational database. But we'd be interested in talking more if anyone wants to look at using Salesforce. Brown University has approved it for level 3 data, so we can make the connection between Qualtrics and Salesforce, but at the moment we don't have the money in the bank to do the front end work. But it is a great question, and we're more than happy to share what we've done with Google Sheets. We have a colleague who is great with the kind of macros and scripting. So he's put in a couple of automations within Google that let us identify kind of duplicate names, for example, or duplicate phone numbers. Great. Thank you all so much. Reach out to Advanced CTR in Rhode Island if you have questions about accessing Qualtrics, if you have questions about clinical research, if you would like some support by statistics or study management. We're here to help you. Advanced CTR is here to help you. And enjoy your afternoon. Thank you.
Thank you, everyone.